Good morning, and thank you for joining us. My name is Missy Bird. I would like to welcome you to this very special COVID response program. Today, we are going to take a look at national community-based programs for survivors of brain injury and how service delivery was impacted during COVID-19. We're going to talk about changes in healthcare and in programs that have been forever impacted by the global events of these last 18 months. Like you, I have many identities. I am a daughter, a world traveler, an actress, and I've also had a traumatic brain injury. When I was on season 39 of CBS's Survivor, I revealed to the world my experiences with my brain injury. I had no idea that sharing the struggles that I went through, from being misdiagnosed to being told that I was imagining things, I had no idea that my story would strike a chord with so many others. I still have people reaching out to me daily to share their own personal stories of brain injury and also to share their journey back to brain health. I can tell you, as someone who's experienced a brain injury, that the services provided by the Brain Injury Alliance to the survivors of brain injury are of critical importance. I want to thank you all so much for being here today. Thank you for coming to learn, to share, and to grow. Thank you for the important work that you do every single day. This work helps those seeking to live well after brain injury. Thank you also to Ann Tarpey of the Governor's Council on Spinal Cord and Head Injury, to Jeffrey Lauer, the chair of the United States Brain Injury Alliance. Thank you to Kristen, to Carrie, Margaret, and Colleen for all the hard work that you did to make today possible. I also want to say thank you to the members of the Congressional Brain Injury Task Force, those who are with us today. The task force is co-chaired by the U.S. Representatives Bacon and Pascrell. Please make sure members of your Congress is serving on their important bipartisan and bicameral body. I would also like to urge you to elevate and listen to the stories of brain injury and the experiences of persons by color and of women. This is a real power that we all share and that we all have when we learn to listen and we fully understand the diversity and the scope of the epidemic of brain injury. Now I would love to introduce Janice Podzimic. She is the Interpersonal Violence Liaison and a certified brain injury specialist for the Brain Injury Alliance of Arizona. And she has a very special welcome for you.
Thank you, Missy. Good morning, everyone. As Missy stated, my name is Janice Podzimic, and I am the Interpersonal Violence Liaison and one of the certified brain injury specialists for the Brain Injury Alliance of Arizona. My daily work consists of connecting survivors of brain injury with resources, support, and education to live well after a brain injury that happens as a result of a violent encounter. Today, we acknowledge, listen, learn, and applaud all of the resource facilitation members you will hear from today and their work with survivors across the country and maybe right in your hometown. Survivors of brain injury are some of the most courageous, strong, and incredible people you will meet. I should know, I am the proud mom to a survivor of brain injury. My daughter was 4 when she sustained her injury by getting run into by a fast-moving train of shopping carts, knocking her many feet away. I was told by doctors to just watch her for any non-ordinary things. I was not fully prepared for the change that she would go through as she got older, but received information and support from the Minnesota Brain Injury Alliance at that time because we lived there when she was older and I was working there. Today, she is a healthy, intelligent young woman. As a family member, I know firsthand the ongoing lifelong support of family, friends, and community resources that need to come together to support living well after head injury. That's why today is so important. COVID has made so many people vulnerable in so many different ways. We also know domestic violence has increased at least 150%. During these uncertain times, there is gun violence, unemployment, housing issues, financial hardships. Domestic violence is being underreported and at worst, fatal. Going forward, there is much work to be done across the country. As Missy stated, I would also like to urge you to elevate and listen to the stories of brain injuries experienced by women and by persons of color. There is real power when we understand the full diversity and scope of the epidemic of brain injury. Thank you so much for joining us today.
Hello and welcome. My name is Carrie, and it's my pleasure to join you today on behalf of the United States Brain Injury Public Policy Committee. Throughout the pandemic, the committee has been dedicated to educating the Congressional Brain Injury Task Force and everyone who will listen really on the ways in which COVID-19 has impacted the brain injury community, all while tracking emerging healthcare policy. And stay tuned, we have more wonderful programming coming this year. We're just getting started. In November, we're going to take a deep dive and look at how the COVID pandemic impacted brain injury research. So thank you to Tom, Jeff, Janice, Dr. Fong, and all our wonderful Public Policy Committee members for the United States Brain Injury Alliance Public Policy Committee. We're here today because the last year, our wonderful and talented resource facilitation staff from across the country started to meet together regularly, forming an ad hoc COVID-19 resource work group. Together, they met throughout the last 18 months and shared how they were making things work for their clients. They got to see change and evolution in real time and learn from their peers across the country. What you will see here today is a report out on the ingenuity, passion, and quite frankly, 18 months of really hard work. Before we get started, a few notes. Today's event is a webinar. We can't see you. Your video is not shown if you're a participant. So eat your cereal, wear your pajama pants. We wouldn't tell on you anyway. You can ask questions in the Q&A chat box of the panelists or in the chat. Kristen and I will be monitoring that and asking those questions as we can. In fact, if you want to pull up the chat box right now, set it to all, feel free to introduce yourself and say hello. You can put your name, organization, contact info, anything you'd like to share. Another note, thanks to Kristen's hard work, today's event has a live transcript option. Click the icon. If you have any issues, please message Kristen or use the panel Q&A to message Kristen and she'll grab that and help you individually. You'll receive a follow-up email from Kristen. If you would like, we can send the slides. And so without further delay, let's get started and hear what our talented resource facilitation teams from across the country have been up to. And again, a special thanks to the USBIA COVID-19 Resource Work Group. Becca Zarambinsky from the Brain Injury Alliance of Minnesota is going to share first.
All right. Hi, everyone. My name is Becca Zarambinsky, and I am a resource facilitator at the Minnesota Brain Injury Alliance. So today I'm going to be talking to you guys about a few different modifications of service during COVID-19. As many of you know, a lot of change has happened with professionals working from home and limited interactions face to face. So I'm very impressed by all of our adaptability and how quickly we were able to adapt and make everything possible. I just wanted to say a quick thank you to Carrie and Kristen and the Brain Injury Alliance of Arizona for putting this on, and to all of you for the amazing work that you do for the brain injury population and working with people with disabilities. Your work is greatly appreciated. So thank you. Okay, so the first thing I'm going to be talking to you guys about is a creative way that we connected to our clients throughout COVID. So we have several volunteers that make handmade cards. Some are super simple, just say thinking of you, and then some are very impressive and extravagant with different artwork on them. But during COVID, we were always just looking for ways to connect, especially to folks who maybe lost someone during COVID, maybe they were sick with COVID, and especially to our senior citizens and maybe those that were in a nursing home or an assisted living that weren't able to have visitors or see family and friends. It was a very tough time. So we kind of were trying to think outside of the box, think of creative ways to connect. So we would start sending these cards, just a quick handwritten note saying, we're thinking of you during these tough times and we're here for you. And so you can see at the bottom, there's 2 examples. And then also we would send activity packets with different cognitive worksheets and activities for people to help pass their time as well as improve their cognition and memory and retention. And then I would be sure to make sure to actively listen to what our clientele was interested in. So if it was sports, maybe send them a couple of ones that had Minnesota sports games on them, or gardening or camping, etc. All right, so here's a couple more examples of some cards that our volunteers have made. And then you can see it's kind of small, but there's just a little sticker that says that our volunteers made this. So we just give our volunteers credit for this amazing work that they do. All right, so now I'm going to talk about some of the support that Minnesota Brain Injury Alliance provided after experiencing trauma. So during early summer of 2020 in Minnesota and in Minneapolis, we just, as an organization, decided to provide some additional support calls after the death of George Floyd and during the unrest after his death. So one way that we decided to provide these additional support calls, our leadership team kind of determined a specific area that was in the heart of the city or most affected, and we went into our database and ran a query with those specific zip codes. So all of these folks that we provided the additional support calls were already in our resource facilitation program, but we just wanted to make an extra call to ensure they were doing okay and just help provide additional support and resources. So I did want to mention that a couple other departments were helping us with this. We had some help from our education department making these additional calls, and quality assurance, and a few others. So the purpose of these calls and kind of the things that we wanted to check in on were, one, just emotional support and providing that additional support and letting them know that we are here for you. We are a resource. If you need anything, please reach out to us. And also just checking in on their safety. And so on these calls, we try to really determine some additional barriers that may be going on. So transportation was a big issue during this time. A lot of highways were shut down, even our Metro Transit programs, which include our buses, our light rails, and then even like shared bike programs. These programs are all suspended. So if people didn't have their own vehicle, it was tough to get around. So we would help provide just information and resources in that regard. Also, we wanted to check in and make sure people were getting access to food. A lot of grocery stores were shut down, or people didn't have transportation to get to the grocery store, or maybe, there was financial difficulties as well. So we would try to connect and just find churches, nonprofits, different organizations that had food available and were looking to help. There was a huge increase of food donations during this time. So there was even some organizations that would deliver a free, either a meal or a free box of food right to your door, which was amazing for some of our clients that were in need. And then we also would check in on making sure folks had access to their medications. Many pharmacies during this time were burnt down, damaged, or closed. So people weren't able to get their medication. And as you guys know, after a brain injury, some people take medication that is essential and they need to take it daily. And if they miss even a couple doses or a couple days, it can be very dangerous to their health. So we wanted to ensure people were getting connected to find other pharmacies that could deliver right to their door. So CVS was an example that they could kind of go out into the suburbs and they would find the medication and be able to deliver it right to people's doors. And then lastly, we just had an increase of connecting people to mental health supports, whether that was reconnecting them to already established mental health professionals or else free resources throughout Minnesota. We have NAMI Minnesota has a peer-to-peer warm line that we would connect folks to. And also there was it was called the Walk-In Counseling Center, an organization that was offering free counseling over Zoom or the phone, and it was licensed professional counselors who volunteered their time to help out those in need. So overall, I mean, we had to be very innovative and just think outside of the box and look for additional resources that were provided in Minnesota and really just try to connect our clients to those resources.
We had a question, or we had a comment from Faye, and Becca, she said, thank you so much. Creative cards are a great way to connect. And then we have a couple of people who thanked us for making the process for joining the call today very adaptive friendly. So thank you, and so easy to do. So now we're going to move on to our next presenter. We have Allie from the Brain Injury Alliance of Iowa.
Hello, everyone. Thank you so much, Carrie. As she said, my name is Allie Martin. I'm a neuro resource facilitator with the Brain Injury Alliance of Iowa. So just going to discuss some of the adaptions that we made and different approaches, including our COVID support group. Okay, so to start kind of our initial efforts really was identifying and understanding we were serving a very vulnerable population. So similar to Minnesota's approach, kind of did that additional outreach to identify any emergent urgent needs. So the process was roughly a total of 2,576 individuals that we contacted by phone and postcard. We created a survey to evaluate access to financials, transportation, medication, food. So again, kind of really looking at those essential basic needs and if there was any urgent needs that were coming from previous and current individuals served. So out of the total, we had roughly 118 that participated in the survey, with 27 that identified emergent urgent concerns. So roughly about 23% of participants identified had a concern. So this is just kind of a snapshot of the screening form that we used. It was kind of a combined effort of all of our neuro resource facilitation staff and wonderful resources, volunteers that we had come on board as well to kind of help us with these efforts. So again, really just evaluating transportation, food, medication, and then if there was any other concerns that were coming about. One example, I mean, there was kind of a hit or miss with contacting everybody in this effort. But one thing we did notice with a few individuals was the access to food, especially in our rural communities of Iowa. Parents that had kids at home and were unable to return to the workforce. So that definitely was identified as a barrier for numerous individuals. And again, thankfully, with support of wonderful volunteers we had on board, we were able to get food delivered, picked up to some of those individuals that were definitely experienced crisis to access necessary resources. This is just kind of a brief snapshot of the postcard. You can't really read it, but essentially just the same approach, letting them know that we were here to support them with resource and access if they had any sort of emergent, urgent needs and concerns. With the facilitation of resources, we definitely shifted just from brain injury specific to really making sure we were up to date with resources in the community. So we maintained on our webpage up-to-date national, state, and local resources. It definitely kind of developed as things did with COVID. So initially it was really looking at access to food, transportation, medication services. Now we're kind of adapting and moving towards vaccine information, vaccine access, transportation to vaccines. So just trying to stay up to date with our resources of kind of how things have developed, including research and findings that we're discovering with COVID. Okay, and that's just, again, a brief kind of snapshot collectively of what the data came out with the emergent and urgent needs. Okay, and this was kind of a unique approach the Brain Injury Alliance initiated was the support group. So findings are definitely indicating that with COVID-19, you're getting the long-term effects, including fatigue, shortness of breath, brain fog, sleep, fever, anxiety, depression. We know a lot of those symptoms definitely mirror brain injury as is. So we definitely wanted to bring some awareness and support around that. Along with the COVID Coping Connections, we did implement our online support group, which has been very helpful for individuals. And with COVID, we're still working to kind of build capacity on that. Research definitely continues to come out, kind of showing what this long haul, long COVID PASC really looks like. So in Iowa, we've had roughly 400,000 to date positive COVID cases, and current research is really indicating about 10 to 30% of those individuals are going to experience, some sort of long COVID symptoms. So, I mean, just roughly trying to think about, 40,000 Iowans that are going to need support in that process. Like I said, we definitely just wanted to kind of get ahead of the game on that with the research coming out to make sure there was an option to support and inform individuals of kind of what to expect, validate experience, expose them to research information. So that's kind of been one of our biggest implementations, if you will, is just trying to get more support going for the community we serve. Okay, and finally we have the Advisory Council on Brain Injury. So they work to provide information to the governor, the Iowa Department of Public Health. They developed a COVID specific task force. So really the mission kind of this task force is, gaining understanding on best practices, supports, accommodations, rehabilitation trends, and kind of what that's looking like for long COVID. So again, target audience is definitely focusing on individuals with brain injury, their family, caregivers, but also the healthcare providers as well. Again, just to make sure we're kind of keeping track on emerging, promising, best practice, and then evidence-based practices moving forward. So hopefully we'll continue to grow and gain some more information with that task force. But yeah, essentially we're just staying up to date on research over here and providing as much support as we can to individuals experiencing that long haul, long COVID effects. And if any questions, please feel free to put those in the chat.
Thank you so much, Allie. That was a great look at how you use data to inform some of your actions, and also kudos on the advisory council pivoting and also having a COVID task force within the council. We had a great look from Becca and Allie at meeting local needs, evolving, and also being sensitive to things that are going on in specific geographic areas that impact our clients. Will Grove is going to take us through some things that happened in Arizona next, including adapting a couple longtime beloved programs that couldn't happen because of COVID.
Thank you, Carrie. As Carrie said, my name is Will at Will Grove. I'm a resource facilitation and outreach specialist with the Brain Injury Alliance of Arizona. Yeah, we're going to do a quick overview of some of the adaptations we had to make to continue to provide as many of the supports and services we had been providing in person. adapted for 2020, 2021, and likely into 2022 and going forward as a result of COVID. So initially, we had to take a lot of our programs, as we mentioned, and adapt them to the virtual world. We also had to work on updating and strengthening a lot of our community relationships, which was much more difficult as we weren't out there in the community physically doing so. We were able to switch to doing our monthly updates on COVID-19 in the brain. As more information was coming out, we were able to put that into a format that we were able to provide to our survivors and family members that was understandable, and constantly evolving with our evolving understanding of the situation. And at the end, we're going to briefly talk about our 2020 fall-funded COVID response through the CARES Act that we recently had approved. So we have some really exciting things that we're just getting started going forward through this fall and the end of the year. So starting with our virtual, our in-person programs, moving to the virtual world, one of the biggest ones was our support groups. Our support groups have been an ongoing thing we have been doing for decades that our survivors and family members really depend on. And at the inception of the pandemic, when things began to shut down, that was very sudden. We did have to shut, obviously, our support groups as everyone else did, and realized we had to quickly figure out a way to make these available virtually and make it so that it is as accessible as possible to any of our survivors and family members. We started putting them up through a Zoom platform. It began with about 6 groups and has expanded now to 8. We actually launched a few brand new groups that will be ongoing and continuing to be virtual. On top of this, we also created our Survivor Sunday Social. This is a brand new event that we are hosting initially bi-monthly and now monthly, somewhat of a hybrid between a support group and a sort of webinar speech kind of thing. We would have a guest speaker come in and present on various topics. Some of the guests were survivors, some were professionals able to discuss a certain aspect of recovery and living with brain injury. And then after giving a somewhat informal presentation, we were able to open that up to all of our survivors in attendance. And it would transition into more of a support group style, very organic discussion. We've had tremendous response with that program, and that is one of the adaptations of many that we've made, initially by necessity due to COVID and the pandemic, that we are going to be continuing to have ongoing. We are exploring what that model ongoing is going to be, while being able to go virtual has allowed us to expand our reach to the more rural areas of Arizona and even outside of our state. Individuals who are never able to come to our groups in person due to their location or lack of transportation have been able to join up and connect with other survivors and family members in a way that they never had before. But at the same time, we also have had individuals who just were really struggling with our Zoom format. We adapted to this by allowing essentially live tech support. If someone calls in, wants to get involved with our groups, Kristen was able to handle that and walk people through the steps of how to either utilize the app, go through utilizing our emails to be able to get into it, or even use their phone, as many of our individuals did not have computer access or were not comfortable with that. There was an option with Zoom where people could call in as well, even just using a standard flip phone. We even went to the extent of having practice sessions. If we had survivors or family members that really just were nervous about trying to log on right away first time, we would just create a Zoom, do a practice, run through, make sure they were comfortable with everything. So that way, when they log into our group, at the start of the support group, they would be able to feel more comfortable with participating. In terms of moving toward what is going to be a hybrid live and virtual model as we move forward, we're going to be seeing some of our groups simply stay virtual. They become so just non-location specific. It simply makes sense to do that, especially our groups that have simply started since COVID and never were in person. Some of them are going to go back to being completely in person, but the model that I'm most excited about us debuting is probably going to start with our Brain Cave, which is our men's support group. We are going to move that into doing a version where we utilize a screen in order to have individuals who are not in the Phoenix area be able to continue to attend our group. But the individuals who want to come in, do our in-person part, still be able to be there. So that's a model we are working on. We're hoping to debut. We're working really hard with the tech people at Ability 360 who provide our support for that group. But I would be really excited to see that and hopefully expand that to a lot of other support group options. Moving forward to our resource facilitation. Fortunately, a lot of our resource facilitation was being done by phone, email, online. That was able to continue pretty much without disruption. We did for a while have to not have walk-ins. We would have people come in and walk into the office and we could just sit down with them. Obviously, for some time, we couldn't do that. But we have made it so that we are able to be available by appointment. So if someone really needs to sit down and have that in-person conversation, we're able to make that appointment, make sure that one of us are available to have that sit down, go through whatever resources, needs, questions that individual may have. This has also meant that we've had to update and be constantly on our toes in terms of the changes in service provision. One of the biggest ones has been the advent, or the increase, I should say, in telehealth. Being able to, people call in and say they're maybe in a rural area, they're not comfortable going into a physician's office or a counselor's office. We had to make sure that we were constantly updating, getting in contact with our resources so that we know exactly who is providing telehealth, who is providing in-person, who is providing both options. And that has been changing, constantly evolving as so many things have, but that's been one of the unique things that we've had to be much more on since the advent of COVID. Another one that has changed with just the nature of the calls we were getting. As you can imagine, we were getting a lot more calls regarding housing support and eviction protection. That was another thing that was evolving constantly. People would call in and we would need to make sure that we knew what funding was available. Where is that funding coming through as those channels were even changing? And if someone is receiving an eviction notice, despite the eviction moratoriums, those notices were still going out. People needed to be able to go through the process, file the correct paperwork to stay in their homes. So people would call us and we had to know immediately where we could send them, who was providing that specific one-on-one work to make sure that we don't have our survivors ending up out on the streets when there was adequate protection in the system. A couple signature programs that I want to highlight. Rays of Hope, that's our big flagship survivor and family conference. A lot of our calendar revolves around that as it's a huge thing for our survivors and families. Obviously, that was usually in person at the end of May. We had to make the decision in March of 2020 that we weren't going to do that in person and fairly quickly adapt that to being virtual. Fortunately, with this particular program, because so much of it is based around breakout sessions or having speakers come in, that was able to be transitioned a little more easier to the Zoom platform. Then the next event that I will highlight that presented an interesting lesson for us. Camp Can Do is another one of our flagship programs. It's an adult summer camp for brain injury survivors that we host up in beautiful Pace in Arizona. Obviously, not something we were able to do the past 2 Augusts, but again, it's something that we have so many of our survivors really look forward to, and we didn't feel comfortable simply just taking that out of their calendar. So that became this long discussion of how do we do a virtual Camp Can Do. Our initial model was us literally taking as many of the activities as we could that we were doing in person and just making Camp Can Do something where we're just in front of the screen instead. So our initial model was Friday and Saturday with event after event after event, a dance party virtually. And we came to a realization that this idea of trying to recreate the in-person event online was not going to be successful. And we had to shift to, instead of what is the best imitation of the in-person event that we can do online, just what's the best online version of this we can do. As we switched our focus with that, we were able to get a much better model for what it would look like. This turned into a 4-week session where it was just 2 hours on the screen every Friday, a different activity that was not an imitation of an in-person thing. It was just something that would be cool on Zoom. And this was tremendously successful. We had an incredible response, people who attended every event. And I think just provided us a really good lesson that as we're going to continue to do things virtually, that's the approach we need to do, as opposed to just trying to imitate in-person things. Another thing that we didn't realize is going to be an adaptation to COVID as we launched it in September 2019 was our peer support team. Our peer support team consists of a Veterans and Military Family Services coordinator who's able to assist any individual or family member of a veteran or someone who is currently serving with navigating resources, especially veteran-specific resources for brain injury. We also have an interpersonal violence liaison who's able to do the same thing for our survivors of interpersonal violence, help reach out, make those connections, assist with finding resources specific to interpersonal violence and the issues that are specific to that. What we did not anticipate in September was how important both of these are going to be, especially from the interpersonal violence standpoint, as we've seen a dramatic increase in incidences of that since the start of lockdown provisions and pandemic provisions. Sort of along the same line, our peer support team has taken a lot of important strides toward addressing substance abuse, especially with how it overlaps with brain injury, which it does significantly. We now have a substance use disorder webpage providing thorough and updated information for individuals regarding substance abuse and its connection with brain injury. We've done a lot of outreach, including, for example, sending out a postcard to a lot of our families, raising awareness about overdose regarding reduced tolerance. To address that briefly, that is an incident where someone is dependent on a substance and ends up in some sort of institutional setting, be that for medical reasons, behavioral health reasons, or criminal justice, who then comes out of that institutional setting, goes back to using at the same level they had been prior and experiences an overdose because the tolerance has dropped significantly. It's a very overlooked danger regarding substance abuse that we were able to make aware through our postcard. We've also used this time, mostly virtual, to connect with addiction treatment centers and specialty courts who have been having survivors of brain injury come through their doors ever since their inception, but had not necessarily been doing that training and having that specific understanding, one, to recognize that brain injury and to be able to adequately work with that individual. We also just recently have launched, we've been doing this virtually, a certification program for certified peer support specialists specific to brain injury. We've held 2 of these trainings so far. We do have another one coming up in November. We certainly welcome any interested professional, and that does not have to be someone from Arizona, who is interested in learning about how to provide peer support for individuals with brain injury. It's a very important and still largely undermet need. We're trying to expand the number of providers who can do this. Anyone who's interested, please get in touch with us. We're happy to welcome you to either our next training in November or one of our ongoing ones, as that's been something we're very excited about being able to provide. Another program that we have adapted in a few ways for the past few years is our Unmasking program. Some of you may be familiar with Unmasking. It is an international program. The Brain Injury Alliance of Arizona has the privilege of being able to administer the Arizona chapter of this. We began this 3 years ago. The essential idea is for brain injury survivors, family members, professionals, really anyone who has a story about experiencing brain injury or experiencing either themselves or experiencing it along with someone, to be able to utilize a mask to use artistic expression to share their story. We've had, at this point, over 400 people come in and choose to do this. And we now are able to take these masks and display them throughout the state, these really breathtaking artistic displays. We've recently expanded this to be able to have people come in and specifically share their stories of their experience with neurological complications from COVID-19, and have adapted this as well so that instead of doing in-person events, we were able to just mail someone a mask, they decorate it, they can send it back to us. It can be done completely without anyone coming in contact with someone else. I can do it totally by mail. We've done a few of these virtually as well. And some of the stories regarding COVID-19 have been really important for us to be able to share and create that understanding of the neurological implications, especially of long-haul COVID. We have also used some of our time, we obviously weren't able to be out there in the community as we would before. We were, prior to March of 2020, we were constantly jetting around the state, meeting with people in person. The need to connect with community relationships, certainly did not end there. We've had to do some different things, involve ourselves with some programs. We've utilized this in some ways to involve ourselves with the criminal justice program, especially. Start creating better awareness amongst criminal justice professionals, first responders, 911 responders, to create better brain injury awareness and create new materials that we can send out to people so they're better brain injury informed. So they know how to, one, recognize and to react when they inevitably experience an individual struggling with brain injury through the nature of their work. And Now, for disseminating information about COVID, obviously there's a lot of confusion around COVID. We all are kind of learning as we go to some extent. We have started a program monthly, COVID-19 in the Brain, just doing updates, different experts and professionals coming in, sharing new knowledge that we've learned, updating on different different concerns with COVID-19 long haul, especially involving neurological implications, treatment. For example, on October 6th, we will have someone, Dr. Mo Mortazavi, who has been providing rehabilitation for COVID-19 long haulers in the Tucson area, and come in and kind of describe how his practice has adapted to being able to serve this population. We can move on to the next one. Last but not least, this is something we're really excited about because we're literally launching it this week. Through our CARES Act funding that got approved relatively recently, we are launching a really expansive series of virtual conferences, sharing information about COVID, covering a myriad of different topics. For example, for National Concussion Day coming up, we have concussion in the time of COVID. That will actually be this Saturday. And then we're gonna have a series going on. These are all free for anyone to attend. As with all of our other things, you do not have to be in Arizona. If you're curious to learn, wanting to stay updated on COVID and on the process of recovery from long haul COVID and all the other implications for it for different populations, please don't hesitate to sign up. Please attend these. Anyone throughout the country is welcome to join this. We're very excited about this program. I think that covers us. Move on to the next slide. I think that's the last slide. But I want to thank everyone for attending and being here to learn about all the different adaptations that we've been doing. And yeah, thank you for taking your time to spend this day with us.
Well, thank you for covering what has been done. And it sounds like in some ways you are just getting started on some other things for COVID. Several people put in chat and in the Q&A that they love seeing the masks and that they are looking forward to using the masks in their own state coming, in the days coming forward, and also virtually. So thank you. Debbie, we're going to look at some things that you were able to do through a Department of Health grant. So we're really excited to hear about what you accomplished in New Jersey. Thank you for joining us.
Thank you, and glad to be here to represent Brain Injury Alliance of New Jersey today. And thank you to the organizers of today's event for the opportunity to share some of our accomplishments in our recent 5-month New Jersey Department of Health grant. I wanted to introduce myself. I'm the Education and Development Coordinator, so I split my time between working with a team of education, outreach, and training community resource specialists, as well as spend some time grant seeking, grant writing, grant reporting. I wanted to also let you know about the acronym ELC. So just to let you know what our funding source was, it was via CDC funds. ELC stands for the Epidemiology and Laboratory Capacity for Prevention and Control of Emerging Infectious Diseases. And it was a statewide initiative to provide resources to enhance detection, response, contact tracing, and prevention efforts to stop the spread of COVID-19. Early on, we put some objectives together for the grant, and we were very happy to be able to impact our target population as well as the general public. These were some of the major goals of the grant. We shifted very quickly, as I see all of the BIA chapters did. We shifted very quickly to providing virtual programs for all of the people that we serve. And during that time, I was also searching for funding sources specifically on this topic. What really caught my attention was the request for proposal clearly stated that the applicants needed to be a 501c3 nonprofit organization, have some target population of an underrepresented or at-risk or vulnerable group, and had expertise in community outreach. So I was very excited to link that prevention, education, and outreach with really BIA&J's expertise in that area. So early on, we did come up with these objectives to conduct community outreach on COVID-19 mitigation to our target population, specifically anyone impacted by brain injury statewide. We were dedicated to disseminating COVID-19 prevention education resource material via BIA&J's website, our electronic newsletter called e-news, social media, our collaboration, statewide Facebook Live events and webinars. And we also developed effective health and safety messages via CDC guidelines for hand washing, social distancing, wearing masks, testing, and vaccination, and certainly saw ourselves as a vital place for the people that we serve to get current, reliable information, people who we communicate all year round. Also early on, we had some just watching news, reading the internet and articles from the CDC, learning more, and also increasing public awareness about long-term neurological and cognitive effects of COVID-19. As what we were learning was the research was suggesting at that time that there's a clear risk for stroke, blood clots, anoxia, foggy brain and neurological deficits, and memory issues that were being experienced by so many people, especially those who had suffered through a long medically induced coma, extended periods on respirators, and who are having and have had serious long-lasting COVID effects. So pretty early on, we decided to provide some material on that subject, which I'll show you in a moment, as well as to plan a webinar specifically on that topic of long haulers, long-term COVID. So it was a $60,000 grant from February 1st to June 30th. As very short turnaround time from when the funding was available. We had about 3 weeks to write and submit the grant, get it finalized, get our staff in order, and so on. One of the requirements of the 5-month grant from the Department of Health was to either hire a new person who would have the title of community health worker, or we could assign one of our staff, which was the choice that we did select, one of our education outreach training team members spent part of her time working specifically on this grant, helping us with the deliverables, and spent about 10 hours a week specifically on this grant. That was one of the requirements of the grant. In addition, we hired a part-time consultant to work on this project with us as a team, had lots of involvement with our public policy coordinator, our director of communications, and so on. So it really was quite a team effort. Thank you. We did want to highlight that in the past, we do have a diverse funding stream at Brain Injury Alliance of New Jersey, and for years have had funding and support from the New Jersey Department of Human Services. This was our first grant from the New Jersey Department of Health, and of course, we were hoping that would open up doors, open up relationships and collaborations. We're also happy to report that because of this grant, 87 individuals who live statewide throughout New Jersey who have experienced a brain injury, as well as their family members, received assistance with scheduling their COVID-19 vaccinations near to their home. Of course, that was a very appreciated service by the people that benefited from it. Next slide, please. I did want to bring some attention, and hope you'll have an opportunity following today's session to check out our COVID-19 resources webpage. We were in the process of updating our page, our website in the spring, and we were specifically glad to spend some time dedicating a web page to COVID-19 resources. So there's just tons of information, resources, vital information on issues linking brain injury and COVID-19. I hope you'll get a chance to look at it at your convenience. As I'd mentioned before, we also had one requirement was to develop a flyer, and we had made a commitment early on that we wanted to do some outreach and develop some resources on the lingering and long-term effects of COVID-19. I'll show you in a moment the flyer that we developed. We also used Facebook Live events 3 different times with large audiences. So this is a copy of it's a 2-sided color flyer on the lingering effects of COVID-19. We'll be able to, because we had some funding for print material as well as branded face masks and so on that we distributed, various other supplies that we needed for the grant. We also will be using this beautiful, as a flyer, as handout material wherever we go, community events, health fairs, and so on. This flyer was widely distributed throughout New Jersey to all of the county health departments, all of the other ELC grantees around the state who we met with monthly for technical assistance sessions. And as well, it was also mailed to the rehabilitation facilities in New Jersey. These were also highlights, posting of COVID prevention messages on various social media platforms. Our webinar took place in June with over 200 attendees, and actually 3 rehab facilities used that webinar as a professional staff in-service training. We were very pleased about that. We did a presentation for our annual Family Fest event, which is a full day event. We were annually, of course, this year it was virtual, and our team did 1 session during that day about brain injury and COVID-19 awareness. And we also have a camp. I was glad to hear with the other presenters information about camp. We have a camp called Camp Trek. For the last 2 years, in 20 and 21, it was a virtual Camp Trek, but we did provide 1 session on COVID-19 and prepared a Jeopardy game for a Camp Trek virtual reunion. The campers, who many of them know each other through the years from attending Camp Trek, a 1-week residential Camp Trek in a beautiful rural camp in South Jersey. This year, of course, everything was virtual. So the coordinator of that program had decided to have quarterly, or with the change of seasons, a quarterly reunion virtually. And we were the guest presenter at one of the reunion meetings, and everybody had a good time playing the Jeopardy game. And of course, we were able to share, information and resources, dispelling myths and misconceptions and so on. It was very well received. As I mentioned up front, one of the things that we wanted to do was to target this group. We wanted to impact all of the people that we serve statewide, as well as the general public. So we got information out to, and believe that all of these individual groups benefited from the information, the current reliable information that we got to them about COVID-19 prevention and education. We got information to all of our care management program participants. We have an active self-advocacy public policy committee that we're very excited about our involvement with them. We have hundreds of people who attend our support groups, and those were all those groups groups were held virtually. Besides getting them and the facilitators information about COVID-19 prevention, just through speaking to some of the facilitators of those groups, we know that the topic and the impact of COVID-19 really just came up organically in the conversations that they were having. Again, we try to impact our adults with brain injuries who attend the Camp Trek program. We got prevention messages out to our support participants in our support coordination program, those who attend our Family Fest, our annual Family Fest virtual event. We have an annual professional seminar, well-attended seminar. It was virtual for the last 2 years. This year in May, when we had our annual seminar, we emphasized that in June of 2021, there would be this seminar about the long-term and lingering implications of COVID-19. So we had lots of opportunity to share that information and publicize and market that information with all of the professionals who often regularly come to our annual seminar. So we did lots of publicity. We had, as I said, over 200 people at our webinar in June. Callers to our bilingual helpline got information and answers to their questions. And we also submitted an article or included an article in our free monthly e-news that goes out to over 5,000 people, as well as supplying an article about COVID-19 prevention and education in the Legislative Advocacy Network electronic publication. So as we were getting close to the end of the grant, we certainly we were concerned with collecting some data about the outcomes and the impact. We have about 37 people on staff, and we surveyed, you can see some of the responses to see the usefulness, the impact and the effectiveness of the prevention education strategies that we were using. 86% of our program directors and community resource specialists referred to BIANG's COVID-19 resources page on our website. Again, I would encourage any of you to take a look at it. We're very proud of it. 81% of respondents discussed COVID-19 related issues with their program participants. 71% of respondents reported that they read or shared BIANJ's social media posts on COVID-19 mitigation strategies, and 40% of respondents reached out to our community health worker for COVID-19 information and resources. And the last slide is just that some of the data that we found on our post-survey results these were topics that were primarily discussed by our staff with the people that we serve. 94% discussed vaccinations, 82% mitigation strategies. So I'll leave that slide up just for a moment. And we were really also happy to share this information, as I said, with the other ELC grantees throughout New Jersey, who I would have to say most of them were designed, most of the other ELC grants in New Jersey were designed to set up COVID testing sites and COVID vaccination sites for target high risk or vulnerable populations. We were very glad to be able to make a mark and have an impact using effective prevention, education, and outreach strategies. So again, thank you for your time.
Debbie, we have a couple questions from the phone from people who aren't able to video in. They want to know what TREK in Camp Trek stands for.
Okay. Oh, I don't have it handy.
Oh,
go on our website, wbianj.org.
Fantastic. And then our second question, we can drop it in the chat later. And
Absolutely.
We also had a question too. How do you handle vaccine assistance requests that come in now? Like if someone has a question about a booster, now that the grant has ended, has that rolled? I think they're trying to ask, is that rolled into your resource facilitation now?
Yes, it would be, any of our staff would be able to assist people. The staff that answer the helpline, all of our care management staff, support coordinators, they would all be working as a team to help people with vaccination appointments, registration, how to get there. That would all be happening right now, even though the grant has ended. Thank you. Oh, I apologize. Together in recreation, exploration, and knowledge. That's the name of Camp Track. So yes, yes, we would continue to assist people in that regard.
Fantastic. And I know that the camps are so valuable. There's only a handful. I know there's one in Toronto, Camp Dawn, in Arizona's Camp Can Do. There's only a handful of those adult camps. And that opportunity to socialize is so important. In fact, from Camp Can Do, I think we've had 2 people meet and marry, and they're both, so it's so important. Oh, we have one more question asking if they can be mailed a copy of the slides. If the presenters are okay with it, Kristen can include the slides in an e-blast. And if you're unable to do email, we will absolutely love to mail you a paper copy. We can follow up with Kristen afterwards.
Sure.
So finally, we were in New Jersey, and now we're going to go all the way to the other coast. Suzette's going to take us through some fascinating things that they were able to do in Washington.
Hey everybody, thank you, Carrie. Yes, my name is Suzette Hart. I'm the Marketing and Development Manager here in Washington. And like my fellow panelists today, our organization made a lot of adjustments to the delivery of services. But what I'm going to talk to you about today was a grant-funded program that we were able to, or we're just wrapping up. It was our brain injury survivor COVID vaccination education program. So our goal with this program was to identify opportunities to be able to simplify and disseminate information to our brain injury community here in Washington. We found an opportunity in early March through the Fred Hutchinson Office of Community Outreach and Engagement and a partnership for the advancement of cancer research to help us in that endeavor. Like New Jersey, we had a very quick turnaround. We applied for that grant in early March, and by the end of March, we were notified that our funding request for just $5,500 had been approved. And we were literally on the ground running immediately with that program. And we identified 3 different opportunities to help us in disseminating information. In March, when the shutdown started across the nation, we started a podcast here in Washington, and we felt that that could be a fantastic avenue to help us share some information. And I'll talk about all of these a little bit, but I'm just giving you a quick overview. We also wanted to put in place a webinar. And then the third way that we felt was appropriate to disseminate information was through educational materials. So with our podcast, we were fortunate to be able to secure our esteemed colleague, Dr. Jeannie Hoffman. She, until recently, was a board member here with BIAWA. She is the program director for the University of Washington TBI model system. And for this podcast, we felt that it was important to, again, really simplify, clarify, and answer questions. And so it was truly a Q&A type of a session, very similar to what New Jersey did with their Facebook Live sessions. It went really well. Our goal for that podcast was to have 200 downloads. As of the end of August, we've had 148 downloads. And so we're not quite at our goal, but the thing that we've discovered with all of this is it's really more of a marathon than a race, and we know that we will get there. Our podcasts continue to live in perpetuity, and if you're interested, you can visit them at braininjurytodaypodcast.com. There you'll find all of our episodes. Our second approach was to offer a webinar. We have done brain health and wellness classes like many other associations or alliances across the country, we paused our classes and we're looking at taking them virtual. So this was a great first step for us to do that. And we were very fortunate to secure Dr. Erin Bunnell with our wonderful partners at the University of Washington. Dr. Bunnell is the co-founder of the Post-COVID Rehabilitation and Recovery Clinic, and he was very well-versed and perfectly suited to lead this webinar. And the focus was the neurologic, cognitive, and social effects of COVID. Again, our hope and our goal was to have 100 attendees, best laid plans. As I know my colleagues experience, you have a lot of registrations, but the number that actually show up are not quite that. So as of today, we've had 75 views, whether in person or post-webinar views of that webinar. And that continues to live on our YouTube page as well as on our COVID page. And you can see that address here on this slide. And then our final method that we felt necessary to disseminate information was through printed/electronic materials. So we developed 2 different mailers. The first one went out by the end of May, and it was, again, very simplified in the information that how to get your COVID shot, what the COVID shots were, what to expect, what to bring with you, those sorts of things. Those were mailed to, our anticipated reach was about 1,500 community members. We mailed to about, or emailed to about 1,000. And then I think we also mailed, I know we mailed about 1,000 as well. After that, we felt it necessary to do a survey to get feedback from our brain injury community as to where they still had questions so that we could adapt and adjust our communication piece for our second mailing. Sadly, we didn't get any sort of response from our community from that survey. So we turned to our friends and our partner at the Fred Hutch, our funders, and asked them for some input. And that helped lead the sample that you see here on the screen. One of the things, in addition to information that they suggested that we include, was focusing on August as National Wellness Month, which was perfect timing because this piece was intended to go out in August. Again, our goal was to reach 1,500 community members. We've met that goal with the mailing of about 1,000 pieces and emails to about 1,000 individuals. For both of these pieces, we put them both in English and Spanish. So the Spanish is on the reverse side, and for our electronic, that we had a separate Spanish version. And we also looped in our Spanish-speaking nonprofits in our community and across the state so that they could help disseminate that information. We are just wrapping up that grant, and we are currently working on our post-grant reporting, which we'll be getting back to the Fred Hutch. And I think that's it.
Thank you. We did have a question. Is your podcast still available?
Absolutely. Our podcast is at braininjurytodaypodcast.com. It is also available with a link through our COVID page, which is biawa.org/COVID.
Fantastic. We also had a question. Someone stated they might benefit from a recording, so Kristen can work on disseminating a recording and maybe even slow down the audio for one of our requesters. Well, any questions as we wrap up today? We want to thank everyone who was able to join us and everyone who presented. It was really exciting to talk about our work and to think about where we are going to go for the next 18 months.